Welcome back, Boise Entrepreneur Week. The action just does not stop for you. I am so happy to be joined by Stephen and Brent from Facible Biodiagnostics. Welcome to the show, guys.
Yeah, thanks.
Thanks for having us.
Yeah. Why don't we start with just a brief intro on both of you, kind of maybe a little bit of background, and go from there.
Start.
Yeah, cool. I'm Brent Fawson. I'm a serial entrepreneur with very little focus. So I've started a few companies here in Boise and California, where I was from a few years ago. And joined with Stephen about 2 years ago when I heard about his crazy idea and what he was working on. And so, yeah, that's me.
So you're definitely infected with the entrepreneurial bug. What about you, Stephen?
Never pictured myself as an entrepreneur. I graduated from college, had the classic, I don't know what I want to do, got my first job, was introduced to a field I knew nothing about. Fell in love with it pretty quickly. Spent almost a dozen or 10 years working as a medical technologist, so the runner of tests for doctors. As I went out to the small rural hospitals, I saw a bunch of problems that really bugged me. Having to explain why test results are inaccurate to people that have kids that are sick, or my mom even, really kind of affected me. Decided to do something about it, or try to do something about it. Went back to school, went here to Boise State, found a technology that was introduced to me. I spent 4 years working on it, trying to get it ready to be commercialized. The last year of my PhD, I started Facible. And I'm a firm believer of diagnostics should be available to anyone, and you shouldn't have to sacrifice accuracy or speed to have quality diagnostic. And so Facible is really founded on the principles of we want to make hospital-grade diagnostics available to everyone, regardless of their socioeconomic status. That's my vision. That's my passion. I found it in the last 10 years, but I never imagined being an entrepreneur. It still doesn't feel like it suits me too well, but it is.
Which is funny because based on everything you say, you're definitely infected with the bug. I know. If you see a problem, it bugs you enough for you to do something. So there's two kinds of people, right? You see the car crash and you run away, or you see the car crash and you run towards it. Sounds like both of you are the kind of person who's going to run towards it.
Yeah, it's kind of perverse in a way, but yeah.
Yeah. So we talked about you two, but I know there's an infamous third leg that couldn't be here today. Tell me about her.
Yeah, Clem, or Clementine, she's our chief science officer. She's also my co-founder. And she has been a major catalyst for us, a major third leg, probably like the main leg for us. So she runs the science. She runs our regulatory. She just had a baby, and she's back in the office. We don't pressure her to come back. We gave her plenty of time. But she's just so driven and just has a singular focus of getting Facible into regulation and through regulation. It's really been kind of amazing to have her on our team. So I wish she was here today, but again, she's dealing with FDA stuff today, and she's hyper-focused on that.
I have a background in medical device development, and if you can have a baby and deal with the FDA at the same time, hats off to you, because I can't do that.
No.
All right, let's get into you alluded to the diagnostics, but tell me, let's get into it. What does Facible Biodiagnostics do? What's the product?
The product is a new technology that doesn't sacrifice speed for accuracy. So normally in medical devices, in vitro diagnostics, you have a test that's either sensitive and accurate, like PCR or the current gold standard test, or you have something that's fast and easy to use, which is more like the lateral flow assays that people see, the rapid antigen tests.
Is a good parallel to that sort of the COVID test these days? You go in, you take one, the 15-minute, but we will get back to you in 3 days. Until then, don't leave your house. Is that kind of...
Yeah, and then they get back to you and say you're negative, but what they don't tell you is that there's a lot of false negatives on these tests. So the literature showing with the major brands, sensitivity, which is how many false negatives, like you're 50% accurate through there.
Wow.
So it's almost a coin toss whether they're going to say, hey, if you have it, you really have it. And that's true. Like, I don't want to misrepresent that. But if you don't have it, you might as well not have gotten the lateral flow test. And that's why the US is focused on PCR testing, is because they're highly sensitive. But they take, at the beginning of the pandemic, 14 days to get your result back. It's longer than quarantine. You don't have your results until you're after quarantine, right? Just go quarantine yourself. And this is the problem that I knew before COVID, that everyone has become really aware with right now, is the state of diagnostics they're not really adequate to handle large volumes, pandemics, where you really need hospital-grade diagnostics right there.
Now, I remember you pitching at the Deal Forum. I attended, it was at Boise State, and I think James Wagner from Jewel Case was there too. And since your pitch then, I understand you've also pitched at the Investors' Choice Conference yesterday. So a lot of pitching going on. Take me kind of through the evolution of what I saw a few years back there at Boise State to what's going on today.
Yeah, and I'd like Brent to chime in on this too. But so when I started, I admittedly lack of focus. As I said, I wasn't taught in the ways to raise a business. So focus. I didn't have that.
He's definitely infected.
Yeah. Right? I didn't have that then. And so the world was my oyster, and I had a lot of cool ideas and how this technology could be applied. And even today, what I said back then is still true. And we've come a long ways on that path. And so, when Brent started, and maybe he can speak a little more to this, but he's like, Stephen, you've got some crazy ideas. And
whoa, young buck.
Yeah, he's like, whoa,
one at a time.
Can't do that, Stephen. And today, and correct me if I'm wrong, I haven't been wrong too much.
No,
as far as what it can do. And
I said, I'm a serial entrepreneur. I'm an investor in the community. And one of the things that intrigued me about Stephen was just how audacious Fasible's vision was, right? Not only revolutionizing the world of diagnostics as we know it, but also adding capabilities into diagnostics that nobody's ever envisioned. We were just reading a report from Johns Hopkins yesterday on how to kind of attack the next pandemic. And some of the ideas and concepts that Stephen brought to me several years ago, they're not even dreaming about yet in some of these reports that we go.
And these are forward-looking reports.
And these are very forward-looking reports, and they're looking at crazy things for vaccines and stuff like that. But really, diagnostics has been kind of stuck in a rut for 20 years since PCR came out. And you look at most technologies, they're iterating on PCR, but they're not doing anything revolutionary. And
evolution as opposed to revolution.
Exactly.
Okay.
And that's really what Stephen brought to me. But as a serial entrepreneur, I know that any business, any startup person that's coming to me is making certain assumptions that are going to fail. And so I was really skeptical about which items are going to fail in your science. And so we've developed our very first product, which is a COVID test. And during that development process, I've been blown away that the crazy things that have come out of this guy's brain are still possible, are still part of what we can do and what we are doing. And so I think it really speaks to kind of the depth of his understanding and also kind of the vision of him. And as I said, it's not just him. We have several PhDs on staff that are just brilliant at what they do. We have biologists, organic chemists.
How many of you are there then?
So we have 5 PhDs and about 15 people total right now.
Okay. Well, it sounds like a perfect match here because you got the crazy dreamer with the audacious, big, hairy, audacious goals and assumptions, and you have the experienced entrepreneur who can
rein them in.
Rein them in. I like that. Yeah, rein them in. By the way, what were some of the other ventures that you started here? I'm just curious.
So my previous company was Saalt. It was a feminine hygiene company.
Oh, yes.
That's here in
Okay,
town.
I know those, yeah.
And then I've started a chocolate company. So it was a company called Ticket Chocolate. And then I've invested in a lot of companies, Natural Intelligence, who's here, and several other companies that are here. So very active in different type of things. This is first time in biotech, so it's definitely been a learning curve to learn about it.
Well, I gotta say, when you talk about anything that has to do with medical device background, it's slow, very risk averse. And anything that you introduce has to be proven out 10 times because people's lives are at stake. Yeah. There's a reason for that. And I got out of that industry for that. I couldn't try out new things. If you were to fail, you basically pack up and you go home.
Absolutely.
That wasn't encouraged. So it's kind of an interesting marriage of an entrepreneurial spirit in an industry that's sort of restrained by, humans' lives being at stake.
One of the things we're passionate about is human health, but our technology is applicable to animal health, environmental health, nutraceuticals, pharmaceuticals. The technology is essentially adaptable to other verticals.
Well, you've chosen the most difficult one, and the requirements are the highest, right? And then that's kind of cool, actually.
It's a great. it's a very difficult path going forward for us because we have to go through the FDA. And we've been out dealing with the FDA for 5 or 6 months now, back and forth. They didn't like something, we go and change it. But it really has proven our chemistry and actually has been pretty good for us as a company because we've seen areas where we can improve it. From manufacturing, we had a first prototype that was a dud in manufacturing, so we had to go revamp.
That's what prototypes are for, honestly, though, right?
Yeah. And then we had, the way that we were showing to the FDA efficacy and things like that, they didn't quite like, so we had some tweaks there. So, like on the quality side, our teams.
It sounds like it's making you a better company, though. This is my take on it. If you choose the highest bar to comply to, then the other verticals are just an easy, right?
Our original prototype was actually in a different space. It was in the CBD market, really kind of doing that.
Interesting.
And when COVID hit, we saw the opportunity to get through the FDA a little more rapid through the EUA process, the Emergency Use Authorization. And it was surprising when we made that pivot as a team, how much more energy and excitement was in solving that problem versus some of these other problems. And so the amount of passion that went into the product, the amount of effort I think that went in the product was substantially more than what we saw.
I don't think the team slept for the first quarter after we pivoted. Just the spark in their eyes is like, yeah, we're going to go make a difference. We're going to help. We're there on the weekends. They're there for 14-hour days because they're just like, we got to go. We got to go.
That must have been such a shot in the arm. I mean, you work on this thing, then the pandemic hit. It makes it so relevant and real all of a sudden.
Yeah, it was a jump starter for sure. I feel like it crammed 3 years of development into one. That's really, it's a double-edged sword. It's dealing with the FDA now, but man, we flew. It was like jazz music coming out of the lab. It was crazy.
I'm going to steal that jazz music coming out of the lab. If you want to describe entrepreneurship, that's it.
It's crazy.
You mentioned the emergency use authorization. So I've been taking COVID tests, rapid tests, because throughout these days, while we distance and we do take precautions to be ultra safe. And I did notice this was not Medtronic. I don't remember which company put this one on, but it had the note on there that says, under the emergency use authorization. I had no idea. So in my mind, I go, oh, so this may not be 100% validated, but it still gives me a sense of security.
It's validation light. It's they lower the bar to get tests in for an emergency use. It's not the first time they've done it. They did it with Zika virus, Ebola. Prior. 2014 is when they first started using them. But this has by far been the biggest in scale. And there's still quite a bit of scrutiny that goes on beneath it. So you heard it with the vaccines. They had emergency use at first as well. Now they're going to the traditional 510K pathway. The diagnostics are starting to catch up, where you're starting to see the PCR tests are all starting to get in their 510K pathway.
And 510K is the FDA's class 1.
Class 1, class 2. And then you move into the pre-market approval type of pathways, de novo.
We're about out of time, but I do want to end on one question here. So what's the next domino for Facible Biodiagnostics? What I mean is it talent, is it product, is it funding, is it all of the above? What are you ultra focused on?
Yeah, so the two main things that we're working on are we have a product, we have it manufactured, we have it ready to sell, we need to get it through the FDA. And so Steve alluded to it earlier, we've been working with the FDA since about April. We've made some great progress, resubmitting on November 1st with a package that we think will be approved. And so once that's happening, then we can go out and sell the product. And then the other thing that we're working on is fundraising. So we do have a bridge fund right now open to try and bridge through that EUA approval to initial sales, but also then fund the next product. We've so far raised about $3.5 million, another $750,000 through grants. And we bootstrapped like crazy to get this first product out there. But the next product is the visionary product, the one that we want. And so we are working up to do a Series A to be able to raise enough money to be able to really knock that product out of the water. So those are kind of the current things that we're working on.
Right on. Well, good luck with this Series A. Investors, you've heard it here. Right here, company out of Boise, Idaho, trying to solve the world's most pressing problems, including health, looking for a Series A round of funding. Thank you guys so much for making the time to come in.
Yeah, thanks for your time.
Yeah, absolutely. Up next is a talk, Selling to the Government, speaking of the FDA, growing your business with government, customers, and resources. But first, a word from our sponsors.